Hello, everyone, and welcome to this chapter 6 on experimental designs. This chapter, by the way, was written by our very own Dr. Lenz, which is pretty cool. And I think it's a great segue into looking at quantitative designs and understanding better what an experimental design is and the factors that make it generalizable to our population specifically that we're looking at for our PICO question, and how to just understand the research that we're looking at better, which is the whole purpose of this class. Um, some things that I just want to briefly touch on from the chapter. I do want to remind you that the purpose of us looking at research is to help our clients. And in this case, you are looking at a specific population of clients that you would like to find out more about. So, being consumers of research is not just about understanding the rationale for a study or understanding the statistics, but it's also understanding the method that is used within the study and how that um, could could validate or invalidate the findings of the study. If we don't consider the method, then the research truly has no meaning. So that's really what the purpose of this chapter is to help us better understand how to evaluate the research that we're reading. There's quite a bit of information in this chapter specifically about the different types of experimental designs. So I do want you to come out of this understanding those, again, the important vocabulary. We've already talked about some of these terms, and you're using them already in your PICO question and in finding your articles. But understanding the difference between a pre-experimental design, where there is no random assignment and no comparison group, a quasi-experimental design where there's a comparison group but not random assignment of participants, and then a true experimental design where random assignment and a comparison group are utilized. Obviously, a true experimental design is going to give us greater validity of our research, but it's just not always possible to do or to participate or to create a true experimental design. So it's not to say that pre-experimental and quasi-experimental cannot be excellent pieces of information and excellent research, but we need to be able to evaluate those appropriately. So understanding that, also understanding that random assignment and what a difference that can make in increasing the likelihood that we can generalize a study to another population. So when we are trying to increase the validity of a study, even if it's a small sample, being able to randomize can be extremely beneficial to us as researchers. Um, Recognizing that the characteristics of an experimental research design so that we can interpret causal inferences would be that random assignment, the manipulation of the intervention or the treatment, meaning that we are doing something, we are changing something, we are applying an independent variable. Measurement of outcomes, which would be the dependent variable, and then controlling for those extraneous variables as we are able. And then being able to have that control group or making comparisons between control groups. That is a true experimental design. So those are just some really important pieces of the chapter. Of course, the chapter also talks extensively about pre-test, post-test, discusses within group designs, talks about factorial design, Solomon 4. Yes, I do want you to be able to understand those specific designs and how they can improve our research and improve our validity and reliability in a design. Those things are also important. But I also want you to just recognize that how to evaluate the research that you are looking at, the research that you are seeing, so that when you do find an article, you're able to identify what type of design it is, or perhaps it's a qualitative study, or perhaps it's a mixed methods study. But being able to evaluate the actual methods that are used, the methodology that's used, and then also evaluate the assignment of participants, and understanding how that can affect, again, whether you will be able to generalize to your population, which is what you want to be able to put into your lit review. So I wanted to take a few moments to share, because last week for our first article summary, there seemed to be some confusion in a few areas, and I am allowing you to redo those. You can resubmit if you would like to, based on some of the comments that I put, because it seems like there was some things that consistently we were struggling with. And I know survey research is different, and so I think part of it may have been because you were pulling from survey research and it was our first article. And so all of those things combined, I think, made things a little more difficult. So what I thought I would do tonight is go through some previous submissions from students, so that you can get a better idea of how to answer those questions based on the information that we've gotten so far from the chapters. So I'm going to go ahead and pull up a specific question. This is from a different semester. So first of all, the APA reference for your article. Please be sure that this is in APA format. I know sometimes within Blackboard, it's hard to get the indentions correct. I know that can be difficult, but the reason I want you to make sure it's in APA format is because this is going to make your life so much easier when you get to your lit review, to put your reference page together if this is already taken care of for you. And remember, Ms. Grotwald mentioned this when she did our video for the library. We talked about it last week. Just because the article says it's in APA format does not mean that it actually, the references are in APA format. So you need to go back and truly check that. I did not take off for this week, but moving forward, I will be looking at that to make sure that it's in APA format. Again, just to make your life easier. Okay, so this was an article discussing, we'll see in just a moment, discussing anorexia nervosa. So here's the participants. Most of you did fine on figuring out who the participants were. That was pretty cut and dry. For the purposes of this article is addressing young children and adolescents with anorexia nervosa. And then you'll notice that this person continued to say, and how most will recover, but a small portion will remain sick. Really, that could be cut off, because all we're asking for here is the participants. So then the next section, what is the intervention or variable of interest? In other words, what is it that we're interested in finding out more about, or what is the variable that we are applying to the participants, depending on what type of study it is? So in this case, it says, the article states that patients with severe anorexia nervosa are referred to as anorexia nervosa plus, which stands for poor life quality, lack of treatment response, unstable and severe symptomology, as to why they remain sick instead of reaching a recovery window. Professionals who label these individuals as terminal or futile, are just passing a prejudgment that can damage the patient's chance to get proper treatment to live a healthier life. So this was a lot of information. So I want you to see what the comment was. When you use words like just, then it shows your bias. This is something that I mentioned to some of you with your PICO questions. You're also asserting why someone still struggles based on one study is a biased way of communicating an idea. There are always many reasons why something is, and reasons can vary. but still produce the same outcome. The researchers are suggesting that based on their study results, negative labels had an impact on the prognosis of clients with anorexia nervosa. So this sentence here would be more appropriate to what is the area of interest. So the variable of interest, or the area of interest, is that patients are referred to as AN plus, and that has a negative impact on the prognosis of clients with anorexia nervosa. So there was some extraneous information here. And then also, again, you want to just watch the use of words like just, even words that signify lower, higher, better. Those types of words are things we want to stay away from when we're looking at research. So what is the comparison? By labeling these patients as AN plus, professionals need to evaluate the patient's life to determine the proper treatment that suits them and their lifestyle, like nutritional rehabilitation or medical stabilization. So this really was not the comparison. And the reason I wanted to point this out is that this happened in our last, for some of us, this happened in our last set of articles that we turned in. Excuse me. Remember that the intervention or the comparison is either if there is a group that's being compared, like a group that gets the intervention and a group that does not. That's pretty simple and easy. From last week, my article, there was the group that was using social media, and then the group that was not using social media. So there's different ways to apply the variable, but you need to look at what is actually being compared. So in this situation, there really wasn't an intervention or variable that was being compared. This information that's given here is actually something that could go here in the outcome. The outcome of this article is to inform clinicians, researchers, and adolescents that treatment plans need to be specified for an individual and not disregarded as a lost cause. And then this section here, we would want to cut that off because, again, this is some bias in language. But that would be the outcome. And then this article relates to my subject matter by providing a foundation on how adolescents with anorexia nervosa can go one way or another if they don't get proper treatment. Also, it supports the claim that if they do fall into a small category of remaining sick, they may need a more unique treatment plan. So this was fine. This went along with the research and was fine. But you can see that some of these other questions, sometimes we get a little lost in the research, and we're answering more than just the question, or we're putting information that's not really relevant to the question. So I'm going to show you another one that I'm hoping will help you to understand. Okay. Okay. So this article was related to infant and child care and relational understanding. Participants were 202 mental health clinicians who attended a 2-day, 4-day, and 10-day conference on attachment theory. You really could have ended with just clinicians, but it's fine to continue. The intervention was a 2-day, 4-day, or 10-day conference on attachment theory. The conference links is the independent variable. Okay, so what is being applied to this group? The conference. They're either going for 2 days, 4 days, or 10 days. So we do have different variables or different levels, excuse me, of the variable. And then what is the comparison? The clinicians were asked to react to a vignette of difficult parent-child interaction pre-conference and post-conference. The post-conference reaction is the dependent variable. So this is what was being measured. The pre-conference parent-child interaction information and the post-conference parent-child interaction information from those two interviews. This is what was being compared. And then the outcome, what the study was actually looking at is, did the clinicians, I'm sorry, use more attachment focused language when addressing the parent-child situation? So at the, I can't remember the numbers now, but at the 2-day, 4-day, or 10-day, was there a difference associated with using the outcome, I'm using the attachment focused language when addressing a parent-child situation? The study is salient to my PICO question as the intervention in my hypothetical study is attachment theory psychoeducation. The results of this study show the more educated an individual was on attachment theory, the more likely they were to use caring and sophisticated means to address parent-child conflict, with notable distinctions between the 2 days and the 10-day attendees. This would suggest that attachment-focused psychoeducation, while helpful, needs to be substantial to make a significant difference in caregiver behavior. So you can see how this directly relates to this person's PICO question. Okay, so that was just a couple of examples of some questions. So I'm hoping that that will help as you're moving forward. Remember that you have to have, for your lit review, for qualitative, for quantitative, and then one treatment evaluation, which we really haven't talked about those yet, and one mixed methods. So as you're continuing, because this week we are talking about experimental design, looking for those types of articles would go along with the information that you're getting from the chapter. So looking for those quantitative designs and being able to evaluate, as we said, based on the design of the experiment, how could it generalize to your question and your population that you are interested in? Remember, your article doesn't have to comprise every element of your PICO question. There may be some information that is left out for some reason of the article that you're looking at, but it can still be relevant to your question. So for example, if your question, and I'm just throwing something out there, if your question was CBT therapy in relation to anxiety and depression, and you find an article about CBT therapy in relation to anxiety, but not depression, that still could be a relevant article to use. You can still see how that would help to compile the information for your lit review to give you a better understanding of how those variables work together. So I hope that looking at this week helps. Remember that you can always ask questions in the discussion board. You can also come to Zoom meeting on Thursday, which will be from 6 to 6:45. You can email me throughout the week as you have questions. As I mentioned, if you want to resubmit that survey, please feel free, the survey question, the Article 1 from last week, please feel free to do that by the end of this week, by Friday, and I will be glad to regrade, as I think we're all just figuring things out and starting to better understand how to write those article summaries. So reach out if you need something, and I hope everyone has a great week.